Hey everybody, Saul Marquez with the Health Matters podcast. I want to welcome you to another episode of our series recorded here in Las Vegas from the Health 2023 event. Today, I have the privilege of hosting Kate Renwick-Espinosa. She is the president of VSP Vision Care, the nation's largest not-for-profit vision benefits and services company. She leads efforts to provide access to high-quality eye care and eyewear services to 85 million members through the network of more than 41,000 doctors worldwide. Kate, thanks for being with me today.
Thank you for having me.
It's a true pleasure. We're going to talk a bit today about the critical role vision care plays in contributing to the overall healthcare ecosystem. Before we dive into that, I'd love to hear more from you, Kate. What got you started in healthcare innovation?
I've actually been with VSP and in healthcare innovation for about 3 decades.
Wow.
And one of the things I just love about healthcare is the fact that you get to cut across care, clinical care, technology, and other aspects of innovation. And the fact that you're impacting people's lives. And just from a personal why standpoint, my father is a physician, but he didn't go to medical school until I was in 4th grade. He didn't start practicing until I was graduating high school. Prior to that, he was a public health educator. So I grew up in a household where we were constantly talking about the importance of healthcare, the importance of people having access to healthcare. And eventually, once he was practicing, he ran a clinic at a Miwok Indian reservation.
Oh, wow. Very cool.
So that was something that just made a connection with me of how important access to care is.
That's amazing. Thanks for sharing that story and how interesting the path that your father took and the influence that it had on you is obvious with the work that you're doing now with VSP. What is the most unique way your organization adds value to health systems and patients?
Healthy eyesight can be life-changing. Just think about every stage of your life. As a child, you have to see well to do well in school. As a young person just getting started in your career, you may think that you see just fine, but not realize that you have underlying health issues. And so going in and getting an eye exam can help you get on an early path to managing prediabetes or other healthcare issues. And then as you get older, taking care of your sight is so critical, whether you're managing cataracts or detecting other eye disease, because just think about whether you want to enjoy life from a personal standpoint or a professional standpoint. Seeing well is so important.
Thank you for that. And there could be oftentimes things we don't realize we have. And so layering in and making sure access is a key part of what we're doing here, I think is a key focus for you guys. Can you explain what you mean by vision care serving as healthcare's secret weapon?
Yes. And that might have been surprising to you because people don't naturally think of eyes as a secret weapon to staying healthy, but they absolutely are. Your eyes are one of the few places you can see directly into your body. You can see your blood vessels. And so it's a way to detect over 270 different health conditions. And people may not go in for their annual physical, but go in for an eye exam. So it's an access point to care that's really important. There was just a study done by the UC San Diego Health, which showed that seeing damage from a retina standpoint can actually be a marker of other underlying health conditions and early detection to heart attacks or strokes. So to be able to prevent something like that before it happens through an eye exam is really powerful.
Thank you for that. And it's really taking a look at the entire body, but the eyes as sort of a gateway to understanding overall health.
Exactly.
Thank you for that. And there's a great opportunity, it sounds like here. How can eye care lower healthcare costs for employers and patients?
Part of it is that early detection. We know that, as an example, in 2020, poor health costs impacted employers by more than $575 billion just in them having to pay for serious health conditions. And then on top of that, another 1.5 billion days of lost productivity. So if you want your employees to not only be healthy, but be productive, it's making sure that they have the right benefits to do that. The more we can detect some of those chronic conditions earlier, not only does that help employers save on healthcare costs, make sure that they have productive employees, but today, a lot of employees are bearing part of that cost themselves. They might have a high deductible health plan. They might have co-insurance. The more we help them manage costs or manage healthcare earlier, it can save them too and protect their pocketbooks.
And so the employers can do a lot here. What specifically can they do to support whole body health for their employees?
One of the things they can do is make certain that they're not thinking of their benefits as being siloed. I mean, our body is everything together. It's not, you don't think about one ear separate from a foot, separate from that. Your whole body goes together. And we need to think about benefits that way and make certain that we're helping our employees use their benefits altogether and that they work in harmony. So that's where we believe, for example, with vision care, having a strong vision plan is important, a high value one that encourages people to go in, get that annual eye exam. And then if something like prediabetes gets detected, to have that optometrist talking to the employee's primary care physician. And that collaboration is so important across the benefits and across the healthcare providers. And that healthcare team is important, and optometrists play a really important role in that.
Thank you, Kate. Yeah, it sounds like it's really a whole body thing. And I think probably, I don't know, I always thought about this. It's sort of the reimbursement models that segment how we take care of this. There's reimbursement for eyes, reimbursement for oral, reimbursement for mental. I love your point of making it aggregated care. Let's look at it that way.
Exactly. Let's think about the whole person and make sure that they're taking care of themselves that way too.
Outstanding. And we're here at the end, Kate, of our discussion, but I'd love for you to propose a closing thought for the people listening to this podcast today. What would you leave them with? And what's the best place they could get in touch with you?
I would say one of the things I want to leave everyone with is that annual eye exams are so important for themselves and their loved ones. And so to make sure whether you have a niece or a nephew who hasn't gone in for an eye exam since they've started school, or you have an aging parent who hasn't made it to the eye doctor, to make certain that you're encouraging those visits. And as far as getting a hold of me, I am available through VSP.com to find out more about our vision care that we provide to employers, but also to individuals. That's a way to sign up and get your VSP if you don't have access to it through your employer.
Amazing, Kate. Thank you for that. Folks, take advantage of the invitation to connect with Kate and the team at VSP. All of the ways to get in touch with them will be in the show notes. And make sure you go and get your eye exam.
Thank you.
Kate, thanks for your time.
Thank you.